This is Jefferson Close-Up. I'm Carol Celine. My guest today is Dr. William Keane, Chairman of the Department of Otolaryngology, or as most people know it, ENT. You worked from the time you were 12 years old all the way through college. So what kind of jobs did you have?
Well, I was sort of a handyman, beginning with, cleaning up around the people that were painting houses, scraping walls, taking down wallpaper, and then started to paint wallpaper myself, do some plumbing and guttering and some electrical work.
Wow, what a great skill to have. Bet your wife loves that.
Oh, absolutely. We hardly have to call anybody. I do it all myself.
Now, speaking of your wife, you have been married for a very long time. You met as childhood sweethearts, didn't you?
We were 15 years old. We met in high school and dated from that time on. So we're married 45 years now.
Now, you have, how many children and grandchildren?
We have 3 boys and we have 5 grandchildren.
And you did tell me that your wife in your marriage was very critical to your life. I thought that was an interesting word.
She was my partner and my best friend. As we say it so often, it's almost like a cliche, but in our case it really is and continues to be. So I wouldn't be where I am today if it weren't for her.
Oh, she'll love when she hears that.
Right.
I'm sure you've told her often. So how did you become a doctor?
Well, my dad was sick. He was in an industrial accident when I was quite young, so he lost his vision and use of one hand when I was 12. So we're used to seeing physicians around and visiting him in the hospital, and so it was natural that I'd want to follow into that kind of a profession. And my brother, who's 5 years older, was the first to go into medicine in our family, and so he was the pathfinder, if you would, and I followed him.
Boy, they must be so proud of you, your parents, both of you.
They are, yeah.
How do you think colleagues would describe you?
Well, I think hopefully friendly, warm, outgoing, someone who's committed to patient care in a tireless way, a patient advocate, fun to be with, I hope.
Those are all good words. If you could change places with anyone in the world, who might that be?
Well, it'd be only temporary, because I really do like what I do. But having said that, I'd like to be a golf pro maybe for 1 or 2 days, have that skill set like a Phil Mickelson or a Tiger Woods, play in a tournament with lots of people around and have the ability to sink a 20-foot putt whenever I wanted to.
I can't imagine a golfer that wouldn't like to do that. Right. Is golf your passion?
It is. I enjoy it a great deal, play it with my family and friends. So it's been a great outlet and a great way of building friendships.
Do you travel around the world? Have you played in Scotland and Ireland in those fabulous courses?
We travel a lot. We played most of the courses in Europe and the United States, but stay local most of the time.
Is there an historical figure that you greatly admire?
I would say John Adams, the President of the United States. Not a well-known president, only now being recognized for what he gave to the country. But he was one of the people that wrote the Declaration of Independence with Jefferson.
Well, you picked a great figure, and he was very committed to his wife, which you share with him.
He was.
Yeah. Is there a fictional hero that you have?
Well, I always enjoyed reading Horatio Hornblower stories. He was he's a great figure, someone who again came up through the ranks as a midshipman and went on to become an admiral of the seas, and I kind of liked that kind of action movie, if you would, but enjoyed reading the books.
That's an interesting choice. What is it about your profession that you really love?
Well, I think it's being able to care for people and do good, if you would. Medicine is a great chance to be part of someone's life, a very intimate relationship, if you would.
What is the philosophy that you would say directs your interactions with your patients?
Well, I treat them as if they're my family and how I would want to be treated. Again, having been a member of a family whose parents were sick and in the hospital a lot, I've seen the good and the bad parts of medicine. And so I try to treat patients like I would want to be treated, or one of my family members would want to be treated, with courtesy, kindness, warmth, availability, hopefully responsiveness, and a clarity in conversation. They understand what the problem is and what we're going to do to help fix it, what the recommendations are.
When you say availability, have you ever been called away from the golf course or from an anniversary party or something?
Always, always. And we're always available, more so now than ever because of cell phones. So we're constantly available 24/7, and that's the nature of the beast. But it's wonderful because medicine's a very jealous mistress, so it's hard to share the bed with anybody else, but it's been a good trip.
Well, how wonderful for your patients to know they can get you whenever they need you.
They can.
Yeah. Thanks.
Thank you.